So hi everybody, you're very welcome to our webinar this evening. We're just getting ready to start, so we'll just wait for people to join us in the room. Hi from Galway. Hope you're very well this evening. So we'll just wait another moment and I'll stop sharing. So thanks everyone for joining us for our webinar this evening on women and leadership and the MBA. And our webinar is aimed at launching our scholarships, the McGinty scholarships, which are scholarships that we offer for women leaders in healthcare, both in medical practice and in allied healthcare. So we're just going to put ourselves on a panel view and then we can introduce our panelists. So I'm delighted to welcome our panelists this evening. Well, first of all, myself, I'm Kate Kenny and I'm the MBA Programme Director here at University of Galway. Joining us on screen is Cliona Murphy, first off on my top left, and she's Consultant Obstetrician Gynecologist and Clinical Director of the National Women and Infants Health Programme. So she has previously been Chair of the Institute of Obstetricians and Gynecologists. She qualified in medicine in University College Cork, we won't hold it against her, in 1993, and currently is a fellow of the Royal College of Surgeons of Ireland, the RCPI, and a member of the RCOG. She has an executive master's in health economics, policy and management from the London School of Economics. You're very welcome, Cliona. Next is Odharna Ní, and she's a specialist registrar in clinical pharmacology and therapeutics. She's currently based at Galway University Hospital, just across the street. And she was the inaugural recipient of the McGinty Scholarship. The scholarships we're launching this evening for this year for female physicians. Odharna completed the MBA at the University of Galway right here in 2022. Her most rewarding leadership role to date, according to Odharna, has been serving as lead non-consultant hospital doctor in Galway University Hospital from 2022 to 23, promoting well-being for NCHDs and representing their needs at directorate level. So welcome to you, Odharna. And the person, I guess, that brings us all together this evening is Dr. Geraldine McGinty, who joins us from the United States, from the Weill Cornell Medicine Departments of Radiology and Population Science. Geraldine is actually a graduate of medicine here at University of Galway and a radiologist specialising in the detection and diagnosis of breast cancer. Geraldine has served as chair and president of the American College of Radiology Board of Chancellors and was the first woman to hold this post. She's an internationally renowned expert in imaging economics and served as a non-executive director of IDA Ireland from 2014 to 2021. And she is a member of the University of Galway Governing Authority. So you're very welcome, all of the panelists. To our attendees, I just want to ask that you would, if there's any questions that you have, that you would please add them to the chat, and we will get to the questions when we can. So guys, let's talk about women leadership and healthcare leadership, which is really what we're here to discuss. The McGinty Scholarship, as you know, it's a key part of our MBA offering. Every year it grows a cohort of leaders, and it's wonderful for me as program director to see that cohort grow and to hear each year of recipients of the scholarship getting together and supporting each other and sharing news of the scholarship and kind of building on the momentum that Geraldine began when the scholarship was first introduced a couple of years ago. So what we want to look at is how and why healthcare leadership is so important. I guess I'm going to start off by asking each of you this question. What has this kind of support, and I mean support by a leader who took an interest in your career, in you perhaps early on, a mentor, if you like, who might have encouraged you into positions, shaped your view of your career, but also work and practice, and what the impact of that person has been. So, Cliona, if you don't mind, I'll start with you.
Thanks very much. So yeah, my background is I qualified in UCC and I did surgery first, and then I moved slightly sideways into gynecology. And there was somebody who took an interest in my career. So I progressed through the program and became a consultant, and actually ended up working in the unit where that consultant Professor Patricia Crowley supported me. And before long, I was in a position where I was being asked to be head of department there. And I was kind of a bit taken aback because you're relatively new, but it is encouraging when somebody suggests you're appropriate and you can, do the role. And then after a number of years, I was asked to be representative on the College of the representative for Ireland on the RCOG in the UK. And I'd have never thought of putting myself forward for the role. But again, it's when a mentor says that to you and you sort of, well, it's a bit about not being able to say no. And I guess you think, well, if they think I can do it, well, maybe I can. So there's putting yourself forward for opportunities, and but if somebody knows you and can, suggest things to you, so it definitely is helpful to have a mentor, somebody who knows you and supports you through your career, and then also, I suppose, being not averse to opportunities instead of saying, oh no, I can't, sort of thinking, well, maybe I can or maybe I should. So I think if anybody on this panel probably would encourage people to do things like an MBA to others, explaining the benefits that they've found from their career. So definitely for me,
Yeah.
having a mentor did encourage me to take steps I mightn't have otherwise.
Do you find yourself doing that? And I don't mean doing that to others, but pushing people are trying to look out for, because a person needs to be in that delicate space where they're ready, but they might not know it. And it's slightly uncomfortable, but one needs the little push. And do you find that that's something that you would do in your own practice?
Yeah, absolutely. I mean, I think any opportunities you have to mentor somebody, whether it's applying, somebody preparing for an interview, preparing for the consultant interview, or other opportunities, it's important that you put out supporting hands and give people advice if they're willing to look for that advice, and then encourage people maybe into spaces they wouldn't have considered. Would you not think of going for that? Or finding opportunities for people to sit on, whether it's working groups or whether it's joining a guideline, because you can see what those things can lead to. That actually, if you have those few things on your CV, you're in line for the next step. And sometimes people are a little reticent and underplay their own abilities. So it is up to us all to nurture each other, I think, and I would think personally that, women are slightly more reticent and only likely to go for a position potentially when they fill more of the criteria. So that's changing a bit, but some personalities, need a little bit more nudging, let's say.
Okay, we're still more reticent. I know it's the old trope, but like you say, just a case of nudging, and then sometimes it's reticence, but also perhaps being modest and an exemplary modesty and self-scrutiny that we can boast. What's interesting about what you said there, I felt, was also that sometimes the individual might know that why the job you're suggesting is more than a simple job or task, but rather it's part of a wider game plan within the sector, not the sector, but within their career path that leads to others. And sometimes it's about painting that map, isn't it, for someone that's less experienced, to say these are the steps and this is the picture. And, we don't always have that big picture when we're starting off,
Yeah, absolutely.
So Orna, you were nodding there when
Oh
Kate
yeah,
was talking.
I absolutely wholeheartedly agree. Like my experience has been very similar. Um, I've been very fortunate in having a lot of very supportive mentors within the clinical context. And it was actually a male consultant colleague who said to me, "Oh, there is this amazing opportunity available." It was, of course, the McGinty Scholarship for female physicians in order to complete an MBA. And I had absolutely no insight into why he would suggest what I would consider to be a business degree to me as someone who wanted to work clinically. And that was what prompted me to start looking into the MBA and what it is the MBA means in terms of developing business competencies, but also looking at leadership competencies and developing both personally and professionally within that leadership context. And then I engaged in this MBA experience, and I've been so blessed to have mentorship experience from Geraldine McGinty, as well as the whole board of advisors. I think it's a huge value add from the MBA, which often people underappreciate. Like, it is this priceless opportunity to have this board of female champions who are actually looking out for you and encouraging you in terms of opportunities that are available. You know, it has honestly just been incredibly worthwhile. And what I found through the MBA and through this board of advisors is that there's been a whole new world of opportunities open to me. And I feel that because I have this qualification and kind of these objective skills that I've developed, that I feel far better equipped to sit at this like directorate level or at a management level within the hospital, and feel that I do understand the problems often as well as many other people there, and that I am equipped to help to develop solutions to the problems.
Right, and can you tell us a little more? So there's two sorts of mentor roles in what you described. Is the person who kind of encouraged you to do the MBA in the first place, and then there's the mentorship that you found through the McGinty Scholarship, and particularly the board and the other advisors. So in what way has that latter one helped in terms of looking at new opportunities, maybe looking at things differently, maybe taking different chances as they arise and so forth?
So absolutely, you know, the board of advisors is a very impressive but also an evolving group of women who act in this advisory role to the recipients of the MBA McGinty Scholarship. And they come from very diverse backgrounds. And even I've seen that Geraldine has definitely curated the group to tailor it to the people who are in receipt of the scholarship. And it's just great to learn from the experiences that they have had and to see how they ended up in the positions that they are in and what skills they needed to develop, and just to have them available where, you know, if you do encounter a new opportunity and you feel the need to learn more about it or you'd like to discuss it with someone, they're always available as a sounding board, but also the group who will encourage you to pursue opportunities that are available to you.
Yeah, it's incredibly important. I also noticed that you mentioned the MBA and the skill set and the different skill sets, and that's something that I really kind of wanted to ask. Having done the MBA at University of Galway, I mean, for those who aren't familiar with it, year one is very much the technical side of business and management. And by technical, I mean the building blocks. So in year one, we learn accounting, we learn finance, we learn marketing, and different sort of electives around things like negotiation and innovation and entrepreneurship. But it's not the detailed nitty-gritty that undergrads will learn. You learn enough about those subjects to understand the details, but also to be able to discuss at senior level, so that you are not you're able to interpret and understand, say, marketing reports or accounting reports and summaries. So I'm smiling because our colleague, my esteemed colleague, Brendan Kennelly, is on the call, who's an accounting professor and teaches on the MBA, fantastic colleague and lecturer on the program. And can you tell us a little bit, because one wouldn't often think of medicine and the practice of medicine together in the same sentence with economics and accounting, which are some of the subjects. So I wonder if you could tell us a bit about that side of it.
So definitely I found, you know, in medicine, you spend your entire life nearly gearing up to do your leaving cert to start the medicine program. And then the course itself is all consuming. And suddenly you're just completely enveloped in the world of hospitals and healthcare and delivering high quality patient care and the fundamental sciences of medicine and healthcare. but you don't develop any competencies around management of a team, how to lobby for change, how to affect change within a very complex organization, or even the fundamentals of how the organization works. And definitely I felt, you know, the core business competencies were absolutely essential in terms of like being able to understand these things and feeling that you're equipped to sit at these tables and listen to conversations around financial reports and accounts. But equally, the things like economics helped to understand where the Irish healthcare system sits within the broader Irish economy, where the Irish economy sits within the broader global economy. And all those things are absolutely vital if you want to be able to make, you know, comprehensive arguments for change within the Irish healthcare system. But additionally, you know, a huge amount of the MBA was around developing yourself as a leader and engaging with people who have very diverse backgrounds, experiences, maybe work in diverse industries. Because within healthcare, there's a huge amount of competing agendas, like even medicine versus surgery versus obs-gynae. While everyone is working to achieve high quality patient care, the things that they feel they need in order to do that are very, very different. And if you are in a management position, you're trying to balance all of these competing agendas amongst stakeholders, which can be immensely challenging. And it's just important to be able to understand the kind of core elements of that in order to be able to affect change.
That's really interesting and also inspiring, to be honest, to see how somebody in your field would interpret and use those subjects as a way of analysing it. Like we do see it every day in the MBA classroom, because people will come back in different programs or in different modules, whether it's marketing or even something around, say, innovation, where the assessments that they're doing, they're actually applying, you know, at work, and then coming back to the lecture and saying, well, this could have worked a different way. And also what I'm finding, I will say as a teacher, sometimes having the toolkit that is being taught in class almost gives you an objective lens to understand a complex problem at work. So one conversation I had last week, for example, with a student who's looking at sort of network analysis, and you know, one of their concerns is how to, like you say, engage a whole range of stakeholders. And it's quite a tricky one because the relationship isn't already there. But then they bring along this tool and use this sort of social network analysis and stakeholder management. And then it sort of takes you a step back and you can look at what that can teach you and how you might move forward, and gives an objective kind of lens, which is really interesting. And you can only imagine from a lecturer's point of view how satisfying that is to see these tools in practice. Satisfying and challenging as well, because MBA students aren't shy about critiquing the more mysterious academic jargon.
Yeah, and I do think
professions sometimes have.
Yeah, and I'd absolutely agree with what you're saying. You know, the fact that you are both working and engaging in the MBA program does provide this unique opportunity to actually apply your learnings. But equally, the MBA is very well designed in that the assignments that we are offered typically are very broad and give you the opportunity to do them based on your own industry in which you're working. So it definitely confers much greater understanding than, say, if you were doing a very general degree and you had very specific questions to answer.
Yeah, I think that's right. And when I'm reflecting on today's webinar, you know, this afternoon, I was thinking one of the amazing things about our MBA classroom in Galway is you might have the person making the stent because of the medtech region in the classroom with the person actually inserting the stent. And
Yeah,
there's not many programs that will have that level. And with our emphasis on allied healthcare as well, which one of the two scholarships, one of the two McGinty scholarships every year is focused on allied healthcare recipient, which is such an incredibly important part of the healthcare delivery ecosystem and the practice. And so it's fantastic to have this kind of diversity within the program as a result. Geraldine, I just want to ask you, when you explained first to University of Galway the initiative and your motivation to bring about the McGinty scholarships and to style them in this particular way, with one each year for allied healthcare and one for practicing medical leaders, and to focus on women, we asked you why, and you mentioned that while women, and I'm sure it's a joy to have our own quotes read back to us, but it's really kind of telling, I think, in this case, you mentioned that despite women making up the majority of the healthcare workforce, they're typically underrepresented in the highest level of leadership. And this was just a couple of years ago. We know diverse teams drive better results and outcomes, so making sure women are prepared to assume senior leadership roles is a key goal. I think it's so helpful for us if you can tell us a little bit more about the motivation that brought you to the decision to take this path in terms of how to try and achieve that aim and try to bring about that specific change that you had identified as being so important.
Sure. Well, thank you. So I was very fortunate early in my career to be sponsored by my department chair to do an MBA. I'd taken on a big operational role, and frankly, I was winging it. And he said, look, I think you need some more business skills. So, that was an incredible catalyst for my leadership journey, and it was a real game changer for me. So I think that there was definitely that, knowing that I could go into any meeting and no one was going to put a document in front of me that was going to scare me. Because I think, let's step aside from women. I think physicians are, sometimes we get to the leadership table and it's easy to feel a little bamboozled by some of the language that we're not familiar with. But yeah, obviously we know that women are a significant part of the healthcare workforce, but when we get up to the top, and I think Ireland, honestly, I will say Ireland's doing pretty well on this. But overall, we're still seeing fewer of those opportunities going to women in senior leadership roles. So what could we do to give women that confidence? Cliona, you said it, women are often looking to tick 10 out of the 10 boxes on the job requirements, whereas our male colleagues, to their credit, are willing to say, I'm going to, I'll take a chance, and I'll take a chance on myself. I don't use the term imposter syndrome as much anymore, because I kind of feel like it implies that we aren't qualified, when in fact, often we're overqualified. But it is easy to feel a little uncomfortable when you're hearing words that are unfamiliar. And I think, to your point, Odharna, when you've been focused on your patient, your unit, your division, and now you're trying to step back in a system which is incredibly complex, right? You've got, as you say, you've got competing agendas even within your hospital system. You've got a health system that has to function inside a country, inside a global economy. So having that context, I think, can be really helpful in trying to navigate the complexities that you're dealing with, and, as you say, effect change.
Thanks for that, Geraldine. And I think that's something that that really is kind of working. I mean, and your own area is breast cancer, healthcare, and is the kind of gender gap present even in that sector?
It's a great question. I think I would maybe answer your question by talking about the deficits in women's health research funding. So if you've been following our news cycle, which can be a little bit dispiriting right now, but some of the good news that's come out recently is the First Lady has taken on a project of funding $100 million for women's health research. And then the president will be including in his budget another $12 billion. Because we know that women are underrepresented in research cohorts, right? I mean, so many of the treatments that we all learned about in medical school are treatments that have only been tested on white men. So, it's important for us to have women in leadership, because then we start to think about things like the fact that, clinical research or research in general has often excluded women. Obviously, breast cancer is a disease that, by and large, affects women. It does affect men too, but too often, as I say, I think we're seeing, even there, we're not seeing the funding being directed to make sure that, newer technologies are appropriately assessed. So I think it's critically important to have, and I'm going to say not just women, but a diversity of backgrounds. So, and something we're seeing, and I think we'll see this in Ireland as the country becomes more diverse, is we're seeing very different outcomes from different groups. Black women are getting breast cancer earlier. They're getting breast cancer that's much more aggressive. And again, unless our research infrastructure can really accommodate a diversity of participants, we're not going to find the answers to those problems.
And the situation you're kind of describing, whether it's when it comes to sort of the predominance of white male medical issues and research money, isn't anything that's like deliberately designed, but rather the voices at the table and the bodies of the people at the table making the decision influence where the money goes, I guess, is the painting that you're, or the picture that you're painting there. And without certain voices at the table taking a seat and exercising power in where that money gets diverted to, then it can be challenging. But to feel, I'm sorry now to go on with the table analogy, but to feel one's place at the table and also to understand everything around the accounting side of it, the business side, the money talk, stakeholder management, the negotiations. Even one of our modules, storytelling, is so important in being able to communicate a particular perspective on strategic management for seeing a longer term outcome and the plan and how it can be executed. All of these things are kind of necessary if we're taking this healthcare leadership more broadly seriously, and I think that's incredibly central into for what you're talking about there. I mean, Cliona, from your perspective, are we seeing similar sorts of dynamics in healthcare funding in the Irish context, and is that something that's changing in terms of what's on the agenda and what's prioritised?
What I would say is, apart from just listening to all that, apart from being, I suppose, literate from the point of view of your microcosm, your department or your hospital, you also need to kind of have an awareness of the bigger picture. So with regard to governmental budgets, with regard to the way the wind is blowing. So we've been very fortunate in the last number of years in Ireland, is that, this particular government took a particular view with regard to women's health. And so there was a pot of money to be lobbied for, if you like, but you needed the mechanism to do your best with that, and so that involved being able to talk about where the priorities were. So there were governmental priorities, and you needed to see where alignment with the medical community met, and then run with that, if you like. So you do need to have the language. You need to be aware of things like MOUs, existing level of service, all of that, and to understand that, and to understand this this new language really. And for me, I've only understood that in the last number of years, even though I'm a consultant for many years. So and a lot of colleagues don't know that, in that they know the negotiation with their own hospital, with their own clinical director, with their own CEO, but maybe don't know the bigger priorities. So what we have seen in the last number of years is definitely a focus on women's health, and it's an element of where that trickles down and how those how that money gets divvied out, and then the trail and where it ends up. And that's part of my role is to ensure that it ends up at the coalface. And the Women and Infants Health Programme has been very successful, I would say, in that area of being able to ring fence and direct money to areas where we've said it's needed, rather than it going into the bigger kind of pot of the health service. But so it's being able to look at all those stakeholders and where you are in that bigger picture is really important. And you can only really be involved if you do have a certain element of knowing the language and having the confidence, I suppose, of something like the education from an MBA will really helps in, being part of that, rather than waiting for it to come to your department or waiting for it to come to your hospital, So
and it's not just the language, is it, Cliona? It's the customs as well. It's we have a structure to our lives as doctors. It's ward rounds, it's presentations, and understanding that, there's the meeting, but then there's the discussions before the meeting, and there's the getting the right people who are going to amplify what you're saying at the meeting, that I think can sometimes make doctors who come to these leadership tables feel like, oh, this is rigged, there's no option for me to participate, when in fact other people have done the legwork in advance to get people aligned with their position, right?
Yeah, no, absolutely. There's a number of phases, but you know, storytelling was mentioned. So sometimes there's a lot of the drier stuff, but then you may, as a clinician, be asked to tell me about what this means for your area. And you need to be able to come up with a scenario where somebody in the non-clinical area can say, oh, okay, so that's where the money will go, and, you know, paint a picture so it is tangible, and that politician or that, you know, person working in the Department of Health can, you know, really sort of see that it would make a difference. And so it is important to be able to bridge that, I suppose, that link between the non-clinical and the clinical, and that's where clinical leadership can really be effective, I think.
That's actually, to go back to Kate, to your earlier question, why I think it's so important to you know, link our clinical and non-clinical people together, right? You know, I do think sometimes, even in, you know, in the best functioning hospitals, we'll call it, on a good day it's just a necessary tension, and on a bad day it's far less collegial than that. And there can, you know, I think it's really important that we, you know, understand what we can learn from each other and what we each bring to decisions, because sometimes, you know, we feel like there's a gap between us, but at the end of the day, we should have a set of shared values and goals around what we're trying to do for patients.
Well, for sure. I mean, as a former civil engineer, I can, you know, I recognize that the cultural sort of gap between engineers, architects, quantity surveyors, and all these kind of, this heritage of we do things this way, and we're kind of, you know, inherently not going to understand the perspectives of these. But in recent years, of course, you've had multi-stakeholder teams and multidiscipline teams. And we're interviewing actively at the moment on the MBA for our September intake, and just in the last couple of days was speaking to a potential candidate who was explaining, actually in healthcare, the multidisciplinary function and the emphasis on this at the moment, and that's not taught necessarily in medical training. And what did she say? It's all legs and lungs or something like this. But with the but there's nothing wrong with learning the science, obviously, but the sort of leadership and the collaborative element and the multidisciplinary group work side of things not being as emphasized. Geraldine, I mean, you've just to talk a little bit more about this fascinating idea of going into the meeting with and that realization that we've all had, where the agenda might have been set at some time in the past, but it's certainly not being discussed at the meeting, that there's a kind of an a priori decision. From your own perspective, this specific area of healthcare leadership and what works in terms of being able to ensure that the outcome that you feel is the correct one and something that you feel passionately about, what have you learned works well for bringing others to your side of the table and being able to see things your way and convincing? Have you anything to share with us on that side, given your experience in this kind of area?
Well, I wouldn't say it always goes the way you want it to, but, you know, I think, you know, if healthcare feels like a place that values driven leadership should be particularly appropriate. So how do we, you know, how do we continue to surface our values? I think that data is something that in healthcare we often find it difficult. There's a lot of denial about data. So making sure that our data has integrity and that we can tell the right stories from it, I think that's important, especially when you're trying to convince physicians about change. Your data better be right, because if it's not, you've lost your credibility. And then I think that with some of the things I deal with, and I sit in the dean's office at Weill Cornell now, so most of my world is administrative, on sort of overseeing the clinical mission. Is to really do that stakeholder engagement. And I mean, really do it. Think about everybody who might have an opinion on this, and then think again and go find the time to go talk to all of them. And anytime I've fallen flat on my face, which has definitely happened, it's because I just didn't take the time to understand the perspectives and understand where people are coming from. And it's not that people are negative, but, you know, and this seems very sort of self-explanatory, but people, smart, committed people, can look at the same issue and feel diametrically differently about it. So unless you understand that going into the discussion, you're never going to be able to frame the opportunity in a way that's meaningful. And you're not going to please everybody all the time. I mean, that's for sure. But you know, especially, I mean, you know, we all work in institutions that have a tripartite mission. We are, you know, equally committed to clinical care research and education, and juggling those three things requires compromise and requires, you know, you to have people on board, but you won't do that unless you've taken the time to get to know people. And some of that's formal, but also some of it's informal. You know, Zoom is great, but it doesn't afford some of those informal conversations. And I will say that I see sometimes our male colleagues being much better at those informal conversations. Sometimes I find myself, you know, I want to get the work done. I know what I need to do. So, you know, I think it's important to take the time to really get to know people.
I would completely agree with Geraldine on that topic. And like, certainly something you see, and something that I, you know, explored a lot through the MBA, is often the people in meetings are extroverted and assertive, but that doesn't mean that they're the best decision makers or that they have the best opinions. It's just that they are the most comfortable at expressing them very often. And it's about, you know, how do you find the introverted person who maybe thinks a lot more about a problem and have the correct forum for them to express their opinions that feels safe to them.
What works well in that case, Orna? I mean, have you found? Because obviously the MBA classroom is, yeah, it's an absolute mix of personalities, of backgrounds, and like that introversion, extroversion, and different perspectives on topics. In terms of enabling kind of different viewpoints, and also I suppose in clinical practice teams, are there any sort of ways that we can think of that bring that out?
Like, this is something that I've definitely learned from Geraldine, but it's, you know, often about those one-to-one conversations that do need to happen, or providing people with the material beforehand so that they can actually gather their thoughts, because some people are much more comfortable expressing an opinion on something that they've read extensively about, as opposed to being asked to give an opinion immediately on a problem that they're encountering for the first time. So it's just about ensuring that you are equipping people to manage the problem in the way that they feel most comfortable in order to get the most out of a team.
Yeah, absolutely. I think that makes sense. I'm smiling at the prevalence are it's always interesting to encounter somebody who's willing to give a learned opinion on something they've just heard of. But it happens more often than we might think. So what I'm going to ask each of you is this question. As I mentioned before, year one of the MBA, which is a part-time program, as you know, it's 2 years part-time, with students coming in Thursday and Friday, roughly once a month, and only during the semesters, but for these intense on-campus lecturing times, lecturing sessions. And we find that year two focuses on building the technical skill set. So if year one is about, okay, now I am versed in accounting and economics and marketing, by year two, then we apply those to strategic thinking and to high level leadership. So that's when we encounter change management as a topic. And that's where Professor Esther Tippmann takes us for strategic management, where our MBA, which is the capstone project, where all the learning from the MBA is applied to a live project. And many of those projects are actually ongoing after people graduate, which is wonderful to see. But it's also focused on wrapping up that personal leadership piece. So anyone who's looked at our open day, and I'd encourage anyone who's thinking about coming on the MBA to go check out our open day this year, or last year, open evening, I should say rather, which has been recorded. You'll get the sense from the students speaking on it that leadership development bit is really important for people. So in the first, I'm going to ask each of you about kind of where this has played a role in your own journey. So to give you some context, the first weekend in year one, we go away to a hotel in the wilds of Connemara, which is one of the benefits of being at University of Galway. And the class spends 2 days both getting to know each other, which is a big part of the class spirit, but also working with our leadership coaches on kind of mapping out one's own strengths and one's own challenges and weaknesses, and looking at that personal leadership style, I guess, makeup and profile, and setting some goals in that area about what one might want to work on and develop. And then, you know, working in groups to share that insight, and then identify how, as a group, one might kind of move forward. And as we all know, if we want to change anything, accountability is a big part of it. So one of the key things I think that a program like the MBA has, over and above those short-term leadership courses that people can do, is that ongoing accountability piece where there's coaches, mentors, and peer groups tracking you and keep saying, hey, last September you actually said you were trying to work on this. Well, now's your time, step up and present, you know, in this group, or whatever it might be. So that's quite a powerful thing, but it can be uncomfortable as well, as we faced with our own personal leadership challenges. And I don't need to tell people on this call, when we're busy with work and busy with lives and busy with family and busy with all the things, at this point in our lives, it can be hard to take the time, but it can be well worth doing. I'm just going to ask you a little bit around that side of things, that aspect of the MBA, the personal leadership aspect, any time that you've encountered that kind of approach, or what it might have brought, because it is a big part of the program. And Cliona, I'm going to ask you there because you're top left of my screen. So.
I think
we
you're frozen on us.
Might have a connection issue. Oh, we'll wait for Cliona to rejoin. So feel free to jump in, Geraldine or Odharna.
Yeah, I mean, I will say that I'm a big fan of team learning, and again, it's not something that we did in medical school, even I think as recently as when Odharna graduated. So I think that part of the learning aspect, and as you say, holding each other accountable, is really a positive one. And then, you know, I think for me, the MBA started a lifelong journey of professional development, and we obviously have to continue to maintain our medical knowledge. But I mean, I'm doing a leadership course right now, which has a study group and has a leadership coach. And, you know, I started a new role 2 years ago, a very different role for me in academic administration. So I knew that my network wasn't what it needed to be in this area, and the role was very different. So I felt like I needed to, you know, hone my skills in a different direction. So I think that, I think you touched on the points, that the ability to learn in a team and hold each other accountable, but also, you know, I do find coaching to be really, really positive. And, you know, I think sometimes, especially in healthcare here, we've used coaches as sort of a punitive thing, or you're not performing well, so we're going to get you a coach. But I'm glad to say that for many people now, my boss has a coach and has had the same coach for 20 years. So that it's becoming more of a, you know, a positive thing, that we will continue to develop our leadership skills. I know what you think, Odharna.
I would completely agree. And like literally exactly what I was going to say was, you know, it really felt like it set me up on a journey of lifelong leadership development, because absolutely it's not a static thing from a personal level, but certainly not static in terms of your team. It needs to be very dynamic and adaptable. And like, even I found that after doing the MBA, it's definitely changed the content that I engage with, you know, suddenly reading, you know, business articles and things like that, or, you know, reading books about cognitive bias or how to engage with introverts. Because, you know, huge learning for me is, you know, not my own strengths, but my own deficiencies in leadership, you know, how to engage with people who are fundamentally very different to me, from diverse backgrounds or different industries, or like definitely on the extroversion introversion scale.
Yeah, that makes absolute sense. And I think that's a massive part of it. And it's always really inspiring to be in the classroom and listening to the different perspectives, but also, I guess, and Odharna, you'll have found this, and Geraldine, in your own MBA classes, seeing how people evolve and change through the journey is really interesting and actually fascinating. And then you meet them a couple of years later. I met somebody 2 weeks ago who'd been on the program in 2018, and they pulled out a credit card size list of the top 6 negotiation skills that they had been issued by their negotiation lecturer. And then I actually asked for a copy of these. I wanted one of these credit cards for my wallet, and I was told I had to do the MBA negotiation module. So there's no perks in this role. But it's
my negotiations class was that's the one folder I've kept from business school, was my negotiations notes. And I actually, from the MBA I teach in here, I invited my negotiations professor to teach. I think, you know, that is something that for many people, and especially for many women, I think is like really a skill set that's so useful.
Yeah, and I think that when it's done well, we can be mystified with how someone can be a good negotiator. And then when you learn that there's a toolbox and an approach and a framework, it's so helpful to even approach problems. I don't know if others have found that.
Absolutely.
Sorry, Cliona, you're back, and you're very
back.
welcome back. We were just talking about the personal leadership side.
Yeah,
and the
so
reflection.
yeah, no, I think the real benefits of an MBA or a master's or anything like that are the people that comprise that, because you know, you get to, I suppose, tell your story, why you're doing this, and then, you know, I suppose it verbalizes that view, and then there's the follow through, and often you make a really good, you know, group of friends or colleagues that are working in different areas. And then you tend to keep up with them and, you know, track their progress and they track yours. So there is that, as you say, accountability and I think a responsibility then, if you've got this knowledge and information and you have developed yourself, then you know, there definitely is this accountability to follow through and do something with it, you know, that I really think is valuable. But, you know, it's more about just the knowledge, which is why the, you know, the in-person piece is really important. I think it's those, you know, conversations, the discussions, and the wider piece, not just the lectures themselves, that I think are really good. But you end up with a group of, I suppose, you know, peer mentors, if you like, going forward. And often the people that maybe nudge you, encourage you to do a course like that will, you know, follow you also and sort of say, how did you get on since you did that? You know, what are you up to now? So that I think that's really helpful. And so I really think the in-person piece, you know, is added value, if you like, for an MBA.
Yeah, I think that's the feedback we get from students, because with after COVID, as you can imagine, a lot of programs were encouraged to consider much more of the hybrid style and the online style, and we actively are defending exactly the model that, because the MBA has been running since 1972 in University of Galway, so we've had plenty of time to experiment with different formats. But this emphasis on the on-campus in-person is kind of treasured, to be honest. And it's the Thursday, Friday that I think people sort of feel like they can switch off from work, and because it's toward the weekend, really focus on being present, being on campus, and focusing on colleagues as well as the learnings around it. Guys, I'm conscious that we're coming to our time. So I was just wondering, before we wrap up, if there's any final comments or thoughts that you had that we haven't covered on the topic. I mean, I think with this topic, there's so much interest, curiosity, and respect for people in the healthcare professions, both medical practice and allied healthcare, that we could keep going for the rest of the evening. But I'm conscious of your time.
I'll defer to my fellow panelists to start. I certainly have some thoughts.
Go ahead,
Okay.
Go ahead, Geraldine.
I think, look, you know, the work that we do in healthcare is critically important, right? And I think it's that jump from what am I responsible for as a physician for the patient in front of me, to how can I make sure that, you know, patient care or the health system is maximally benefiting the people I live with, you know, the people around me. You know, that's what we want to have physicians. We want physicians to be part of those bigger decisions, right? And I think that, you know, there's some evidence here that physician-led health systems have better performance, but we're not going to be able to make that impact unless we come to the table feeling prepared. So I think it's essential that physicians are in leadership. And I think that it's important that when we get there, we know the language, we know the customs, and we can participate effectively.
Yeah, absolutely. So it's really useful way to put it, that leap from the immediate focus on the patient in front, which is how people begin and go through medical training and practice, to then move to the systemic landscape and see the big picture and to see oneself as a part of that big picture and shaping it and changing it, drawing on experience and practical knowledge. Cliona.
Yeah, so I think there comes a point, you know, for a lot of clinicians, they get frustrated as to why are things like this, you know, and whatever it is. But, you know, if you don't like the way things are, then it's incumbent upon you to strive to, you know, improve that. And part of that is a knowledge in the systemic workings of healthcare. You can be a brilliant physician seeing patients, but if you don't get involved in the other part of the machinery, then, you know, you can't complain about the other people who do, you know. So there's an element of, you know, if you want things to change, you have to be part of that change yourself, you know, and then you need to get the tools to do that. And that's where I think, you know, that's the point that a lot of people get to. They're like, I want to do a bit more than doing my clinics or doing my clinical work. And for some people that they absolutely don't, you know, and that has to be respected as well.
Well, I would say then, Cliona, the responsibility of those of us who go into leadership is make sure for those people that they get to thrive, that we're creating systems around them that allow them to do that with focus and impact.
I was literally going to say the same. Like, we have a duty, and I think as the clinicians on the floor, we have a very good insight into the challenges that are faced on both a patient level and a physician level. And we do have a duty to both our colleagues and to the patients to deliver them the best service that we can. And in order to do that, we need to be best equipped to do it in terms of both our clinical skills as well as our business skills, and to try to bridge that gap.
Well said, I think, and I suppose to wrap those tools that you mentioned, Cliona, there's two aspects. There's the skills in terms of how organizations work and how management works and how one can lead others. And then the other key part of the tools is the other people with you on the journey, whether it's your mentors, whether it's your colleagues, or the people that you can persuade to help bring about the changes that you identify. Guys, it's been such an interesting evening. Thank you so much. I just want to sort of remind people on the call and who are watching us on the recording about the McGinty scholarships. Geraldine here established the scholarships in 2020 in order to empower, as we've heard, a new cohort of women who will lead improved and impactful outcomes for patients and healthcare staff. But I think from listening today, we can add the rest of society to this, because obviously there's not one of us that isn't directly affected by healthcare systems, the choices that are made, and the decisions around practice, around funding, and the other aspects that we've heard about this evening. So the scholarships are aimed at enabling female physicians and allied healthcare professionals to engage in the MBA. And please do let friends, family, colleagues know about these wonderful opportunities and the scholarships, both for physicians, but also allied healthcare, which ranges from nurses, midwives, dietitians, music therapists, occupational therapists, paramedics, physiotherapists, podiatrists, radiographers, and many others, so that we can spread the word about this wonderful opportunity. So I would encourage you to do this. One of the things, we're delighted on the MBA, we do have scholarships that we focus on encouraging the kinds of people that we feel are important to support in the kinds of professions, because the MBA at University of Galway is offered by the J.E. Cairns School of Business and Economics. And that school, our school, has a very specific mission with its School for Business aimed at the public good, and not just in name only. This is through and through with the various strategies and changes that have been going on over the last number of years within this School for Business. So we're very proud to say that. So in terms of, we've also launched, I should mention, a scholarship, the Colm Feeney Scholarship, which is Generous Legacy from Colm's family, recently launched to support community and voluntary sector MBA students and students from the SME sector. There's a number of other supports, and one thing that I will thank Geraldine for this forward-thinking initiative. When people talk about the support for the McGinty Scholarship, it is the scholarship itself, obviously, but the mentorship that has been a huge aspect, a very powerful aspect of it. And so that's something that has been brought in the Colm Feeney Scholarship and some of the other supports that we offer on the MBA, because the value of it is what we hear about again and again. So it's kind of, you know, thanks to you for for inspiring that, and but also thanks to the recipients of the scholarship and the collegiality that's clear and ongoing and building, which is wonderful to see. So for anyone interested, all the information is available on the MBA website at University of Galway. There's other things to watch. I'd encourage you to don't listen to me, listen to our students, and you can watch back our open evening from this year or last year. Or if you'd like to speak to a current student or someone who's been on the program recently, we're always delighted to connect potential applicants to people who can tell you their own experiences. So please do get in touch with the program if that's what you would like. But I think to close this evening's event, I just want to say sincere thanks to our panelists, Cliona Murphy or O'Harna. Sorry, I will apologies for my mispronunciation, and I will learn. And most of all, Geraldine McGinty. So thanks for joining us this evening, Geraldine, and enjoy the rest. So wishing you all a good evening, or in Geraldine's case from the US, a good afternoon. And thanks to everybody. Take care.
Thank you.
Thanks very much.